Hi, Natalie Mabry with the Skincare Center. Wanted to talk to you guys about a new medication that we have at our disposal now. So in our plastic surgery setting and in the skincare center, when we have lasers, sometimes there's pain involved. And so, opioids were available, but they can cause sedation, constipation, and they have opportunity for abuse. So now we have a new medication called JOURNAVX. Other name is suzetrigine, and it works in a completely different way. So opioids work in the brain. This medication will just go ahead and block the pain signal before it even gets to your brain. And it's non-sedating. We only use it for a couple days, but we have Caroline here today, and she was able to use this medication before she got the tribrid laser, and she is a self-professed pain baby.
Yes.
So she was a perfect person to try it on. And if you can think about lasers, sometimes when they're zapping you, you can kind of like move a little bit and you can't help it. But this kind of helps block that pain signal from even traveling up to your brain. So how did it feel?
So I'm somebody that can't handle pain at all. I probably get a laser done once a year and I'll numb for an hour and I still will feel the pain. I have no pain tolerance. There's things that I will just say, I'm not doing, that I see people do all day long and they don't have a problem with it at all. But I took the medication and I seriously did not feel anything, maybe a little bit of heat, but nothing crazy. And I was completely fine for the rest of the night, where I've heard that this laser, you feel a little hot the night of and the day after. I think you said that too.
Yes, and I
Yeah.
was in there and I did the last part of her laser. So I was like, if I'm doing the last part, this is when she's going to be fatigued and kind of not like be able to stand it, but she was fine.
Yeah, I was completely fine. So I recommend it. I will now say that I will never do a laser without that. It's a game changer and I really, really, really enjoyed it.
Okay, last thing, safety. If you are in severe liver failure, you would know it and you can't take this medication. Also, it can make some other medications not act quite right. So if you are on a certain antibiotic, if you are on antifungals, you need to let us know, which we're going to ask you. And then just for my women of childbearing age, it can make certain types of contraceptives a little bit less effective. So you want to use a second method. But again, we're going to check all this with you before we give you this really wonderful pain control medication.